Will you marry me?
Sweet.
I don't know, it might have been crooked. I'm pretty sure it's on there. Let me get your clothes.
Just so they don't know how affectionate we are from Pittsburgh. Okay. Okay.
Edit.
We're going to look at the first metacarpal carpal joint right here. Make sure you're down here on this joint. You're not up here at the MCP. You're down here. This is going to roll out this way, right? And so what we're going to do is we're going to roll it back under this way. And as we're rolling it back under, we're going to take just at this joint, just proximal to it, we're going to lift and set it under, just like that. Boom. Okay?
Wait, can you do the motion for it?
Yeah, let's look at the good side first. All we want to do is basically we want to roll this joint around. We want to make sure that it rolls out like this way. This is the misalignment, so this is what you can show Dr. Power or me. It's rolled out like this, and we need to move it back this way. Okay? So we're going to roll it under, make our adjustment. But you'll motion the good one, then you go to the bad one. You'll note that it's not rolling back. It's gone posterior lateral. It's not going anterior medial. So your objective is to increase that motion and reset the joint. Okay? When you get on the dips and the pips, we're just going to be looking for you to see them going side to side, basically like this. If the wedge is open laterally, it's not going to move medially. So if it's open laterally, you're going to come over like this, grab it this way, and you're going to motion it this way. You're going to traction it, and when you thrust, you're just thrusting through your the distal joint. This
So
way.
the open wedges to the lateral.
Yeah,
Correct.
it would be open like this. So that means it's not going to move medially. Okay? And I don't care if you do that this way or this way. I don't care if you do it supine or prone, doesn't matter. The carpals, all we're going to do is a P to A to P glide on the bones. Okay, so if you have, say, a very common one is an anterior lunate. If a lunate, basically you find it, you come down here. If the lunate has gone anterior, it's not going to go posterior. So you're going to put your thumb on thumb contact right on top of there. With your chiropractic index fingers, you're separating the rest of these, and then you're stabilizing the distal radius and ulna, and the thrust is through this way. Okay? Everybody got that? Any questions on that? Okay. That's about all for the wrist, right? I mean, there's other things that we've talked about. It's all on the test. When you're looking at the TMJ, I'm going to have you take your glasses off and you can. Okay. You're going to have the patient put their head back just like this, and we want to have what here? And what side's up top? Flat side. Flat top. Very good. Then we're going to look at the TMJ. We're going to look right here at the symphysis menti. We're going to stabilize right in, not stabilize, but palpate right at the TMJ joint. You're going to have him open his mouth nice and wide, and slowly close it. When he slowly closes it, you're going to look for traction and coming up through here. Or not traction, you're going to look for the way it tracks, excuse me, as it's coming up. If it deviates, let's say it deviates left and then right, which is the bad side? Right. You're going to have to be able to explain that to us on the test. Okay? So we'll just say that the right side's the bad side. We're going to have the patient open their mouth. We're going to put our thenar up here, up on the joint. Our pisiform is going to be down here on the angle, and we're going to be down here also on the symphysis menti. So when you show us on Charlie the points, and we say, well, what's your contact points? You're going to say here up at the joint, you're going to say here down at the angle, and you're going to say here on the symphysis menti. Okay? So this is the bad side. What we're going to do is take our contact. We're going to have him open his mouth. And as he's closing his mouth, we're going to be pressuring him, right? Or her. And as we're pressuring him, we're keeping this coming in. This is coming in. With this hand, it's coming posterior and medial, just like this. This way. And this one here, I'm pulling back. I'm going to have him extend his head a little more. I'm going to pull back this way, pulling down on the symphysis menti as I'm pulling this all in. Okay? Stabilizing, bringing this in together. Okay? So this is coming back and in. This is coming back while it's going down. Okay? Pulling the symphysis menti down and pulling it back. Catching the good side, the bad side up to the good side, trying to get them to close at the same time. Okay. Trying to get them to close. Right. Okay, any questions on that? All right. Whatever you need, ask Dr. Power or myself, and we'll come help you. There are other things. They're the only ones.